Last September, I almost lost my own father to something I never saw coming. Not a medical error, not some rare genetic condition we missed, complete ignorance. I've been a cardiologist for 17 years. I've performed over 2,400 cardiac procedures. I've published research. I've lectured at medical conferences. I've saved lives in the ER at 3 a.m. when every second counted. My father called me at 7:22 a.m. I remember the exact time because I was in the middle of my morning coffee scrolling through patient charts before heading to the hospital. "Son," he said, his voice strained in a way I'd never heard before. "I feel dizzy, my heart's racing, something doesn't feel right." Now, you need to understand something about my father. He's not the type to complain. He grew up in a generation where you tough things out, where you don't call your son the busy doctor unless something is genuinely wrong. But I dismissed it. I told him what any cardiologist would say to their parent who just woke up feeling off. "Probably nothing, Dad. Your heart's just adjusting to being awake. Sit down, drink some water, take some deep breaths. It'll pass." I was so confident in my diagnosis that I didn't even consider telling him to call an ambulance. 48 minutes later, my mother was screaming into the phone. My father had collapsed in the kitchen. His lips were turning blue. She couldn't find a pulse. The ambulance arrived in 6 minutes. The paramedics worked on him for 12 minutes before they got a stable rhythm back. 12 minutes. Do you know what goes through your mind when you're a cardiologist and someone tells you your father's heart stopped for 12 minutes? Every worst-case scenario you've ever studied suddenly has your father's face on it. Every statistic becomes personal. Every percentage becomes a prayer. I met them at the hospital. I watched the ER team work on him. I stood there in my white coat with all my credentials and all my experience completely helpless, a spectator in the most important moment of my life. The ER doctor, Dr. Patricia Chen, someone I'd worked with for years, pulled me aside after they stabilized him. Her face was serious, the kind of serious doctors reserve for delivering difficult truths. She asked me one simple question that changed everything. "What was your father doing this morning before the symptoms started?" I had no idea. I called my mother. She was still shaking from the trauma, but she walked me through his morning routine with the precision of someone who'd watched the same pattern unfold for months. "Nothing unusual," she said, "just what he does every day. Same thing for the past 8 months since he retired." And that's when it hit me like a freight train. His normal routine wasn't the problem. The timing of his normal routine was a ticking time bomb that had finally detonated. "Before I go any further, I need you to do something for me. Write down in the comments right now, what's the very first thing you do after waking up? Not what you think you should say, what you actually do. I'm serious. Write it down because what you're about to learn could save your life, but only if you're honest with yourself about what you actually do every morning." My father survived. After 3 days in the ICU and 2 weeks of recovery, he came home. But he's not the same man. He lives with the knowledge that his heart stopped, that he was clinically speaking dead for 12 minutes, that his brain was without oxygen for 12 minutes, while paramedics shocked his chest trying to restart the engine that had been running for 68 years without pause. And the worst part, the part that keeps me awake at night, it was completely preventable. Since that day, I've become obsessed. I've interviewed over 180 patients who survived sudden morning cardiac events. I've reviewed every study on circadian cardiology, chronobiology, and cardiovascular timing I could find. I've spent hours analyzing data that most cardiologists never even look at because we're trained to treat disease, not prevent it. And I discovered something the medical community is only just starting to understand. There are 5 specific morning behaviors that create a perfect cardiovascular storm in people over 60. Not dangerous behaviors in themselves, not things that would raise red flags in a typical medical examination, but when you do them in the first hour after waking up when your body is already under maximum physiological stress, they can stop your heart. My father was making one of these 5 mistakes every single morning. And based on the research I've done since, based on the conversations I've had with hundreds of patients, there's a very real chance you're making at least one of them too. If you're over 60, or if someone you love is over 60, I'm begging you to subscribe to this channel right now. Click that subscribe button because I'm going to spend the rest of this video sharing information that could literally prevent someone you care about from becoming another morning cardiac statistic. I know you might think you'll remember to come back later, but here's the truth. You won't. The algorithm will bury this, and the person who needs this information, maybe your parent, maybe your spouse, will never see it. Your subscription right now is how we make sure this reaches the people who need it most. Let me explain what happens to your body the moment you open your eyes in the morning, because once you understand this, everything else I'm about to tell you will make perfect sense. Your body doesn't turn on like a light switch. It detonates. First, your circadian rhythm triggers a massive release of cortisol, the stress hormone. Within 15 minutes of waking, your cortisol levels spike by 50 to 60%. This isn't a gentle wake-up call. This is your body slamming the accelerator, forcing your heart rate up and constricting your blood vessels with brutal force. Second, your autonomic nervous system shifts violently from parasympathetic mode, rest and digest, to sympathetic mode, fight or flight. Adrenaline floods your system like a tsunami. Your blood pressure shoots up by 10 to 20 points in a matter of minutes, sometimes more. Third, after 7 to 8 hours without drinking anything, you're severely dehydrated. Your blood has become thick and viscous like honey instead of water. Your heart has to work 3 times harder to pump this sludge through your body. Now imagine your heart, a heart that's already been beating for 60, 70, or 80 years facing this morning storm. Arteries that are naturally less elastic with age. Blood vessels that don't respond as quickly. A cardiovascular system that's been working nonstop for decades. And then imagine adding behaviors on top of this biological storm that amplify the stress even further. That's what my father did. That's what millions of people do every single morning without realizing they're playing Russian roulette with their cardiovascular system. The first deadly mistake is something 87% of people do without even thinking about it. Jumping out of bed the second the alarm goes off. You hear the alarm, your eyes open, and immediately, like you're responding to a fire alarm, you swing your legs over the side of the bed and stand up. You're in motion before your brain is even fully conscious. It seems efficient. It seems disciplined. It seems like what productive people do. But for people over 60, this simple movement can trigger something called orthostatic hypotension, a sudden catastrophic drop in blood pressure that can cause falls, fainting, and in extreme cases, fatal cardiac arrhythmias. Here's what happens in your body. When you've been lying down for 8 hours, your blood is distributed evenly throughout your body. Gravity isn't pulling it anywhere. It's in equilibrium. The second you stand up abruptly, gravity suddenly pulls up to 1 liter of blood down into the veins of your legs and abdomen. 1 full liter. That's a massive redistribution of your blood volume in seconds. Your heart suddenly has much less blood to pump to your brain, and your brain needs constant blood flow to function. It can't store oxygen like muscles can. Every single second without adequate blood flow starts killing brain cells. In young people, pressure sensors called baroreceptors detect this drop instantly and tell the heart to beat faster to compensate. The response is so fast, you don't even notice the adjustment happening. But with age, these sensors become slow and less sensitive. They're like smoke detectors with dying batteries. There's a lag between the drop in pressure and the compensatory response. And during that lag, your brain doesn't get enough oxygen. You feel dizzy, your vision blurs, you see stars, your legs feel weak, and in the worst cases, you faint and collapse. Falls are one of the leading causes of death in older adults. Hip fractures, head injuries, internal bleeding, and many of these falls happen in the first few minutes after getting out of bed, when people faint from orthostatic hypotension. But the danger goes far beyond the fall itself. When your body finally realizes what's happening, when those slow baroreceptors finally sound the alarm, it panics. It overcorrects. Your nervous system releases a massive surge of adrenaline to jack your blood pressure back up. Your heart goes from struggling to pump enough blood to suddenly being forced to pump against extremely high pressure. This creates something called reflex tachycardia. Your heart starts beating fast and violently, like an engine being revved from idle to maximum RPM in seconds. And this sudden, violent acceleration can trigger fatal arrhythmias in a heart that's already under stress from the morning hormonal storm. Ventricular fibrillation, sudden cardiac arrest, dead before you hit the floor. The solution is absurdly simple. When your alarm goes off, stay lying down for 30 to 60 seconds. Take 5 deep breaths. Let your body know there's no emergency. Then sit up slowly and sit on the edge of the bed with your feet on the floor for another 60 seconds. Move your ankles in circles to activate the muscle pumps in your calves that help push blood back up to your heart. Only then do you stand up slowly. Those 2 extra minutes could be the difference between a normal morning and an ambulance at your door. Write in the comments, do you jump out of bed immediately, or do you take time to wake up slowly? Be honest, there's no judgment here. I just want you to think about your pattern. The second deadly mistake almost no one thinks about: not drinking water immediately upon waking. Most people go straight for coffee. Others head to the bathroom. Others grab their phone and start scrolling. They completely ignore that their body has spent 8 hours losing fluids through breathing and perspiration. Every breath you take releases moisture. Every hour of sleep your body loses water. By the time you wake up, you're in a state of significant dehydration. This creates what's called hemoconcentration. Your blood volume decreases, but the number of red blood cells, white blood cells, and platelets stays the same. The result: blood that becomes thick, sticky, and dangerously prone to clotting. Imagine trying to pump honey through narrow pipes instead of water. That's what your heart is dealing with every morning when you don't hydrate immediately. It has to generate much more pressure to push thick blood through your arteries and capillaries. This dramatically increases the workload on your heart at precisely the moment when it's already under maximum stress from cortisol and adrenaline. But thick blood isn't just hard to pump, it's dramatically more prone to forming the blood clots that cause heart attacks and strokes. When blood is thick, platelets become stickier. They clump together more easily. They're like magnets being pushed closer together, and if there's any damage or instability in the plaque inside your coronary arteries, these sticky platelets pile up at the site, forming a clot that can grow until it completely blocks the artery. This is literally how most heart attacks happen. A blood clot forms on top of an unstable plaque and cuts off blood flow to part of the heart muscle. And it's no coincidence that most heart attacks occur in the early morning hours between 6 a.m. and noon, when blood is at its thickest and stickiest. The statistics are terrifying. The risk of heart attack is 40% higher in the morning than at any other time of day. The risk of stroke is 49% higher in the morning. Why? Because of this perfect storm: thick blood from dehydration, elevated cortisol, spiking adrenaline, and increased blood pressure, all happening simultaneously. The solution is so simple it almost feels too easy. Leave a glass of water on your nightstand before bed. Make drinking 300 to 400 milliliters of room temperature water your absolute first priority. When you wake up, before your phone, before the bathroom, before coffee, before anything else, this simple habit immediately begins to reverse the HEO concentration. Within minutes, you're diluting your blood, making it more fluid, reducing the viscosity, lowering the load on your heart, decreasing the risk of clots forming. In a matter of minutes, you're literally diluting the danger. The third mistake is something 80% of people think is absolutely necessary to function: drinking strong coffee, especially espresso or very concentrated coffee, on a completely empty stomach right after waking up. This is a cardiovascular bomb disguised as a comforting morning ritual. I love coffee. I'm not going to tell you to never drink it, but the timing and the way you consume it can be the difference between a harmless pleasure and a cardiac trigger. Caffeine is a powerful stimulant. It triggers a massive release of adrenaline from your adrenal glands. It accelerates your heart rate significantly. It causes vasoconstriction, narrowing your blood vessels, and spiking your blood pressure suddenly and intensely. Now, remember, your body is already dealing with elevated cortisol, thick blood from dehydration, and the abrupt transition from sleep to wakefulness. Your cardiovascular system is already running at maximum capacity. Adding a caffeine shock on top of this is like throwing gasoline on a fire that's already burning out of control. For young people with elastic arteries and healthy hearts, this might be tolerable. The body can handle the additional stress, but for a cardiovascular system that's worked for 6, 7, or 8 decades, that has naturally stiffer arteries, and potentially undiagnosed coronary disease, this combination can trigger dangerous arrhythmias, severe hypertensive crises, or even sudden heart attacks. When you drink coffee on an empty stomach, the absorption is dramatically accelerated. There's no food to slow it down. Caffeine hits peak blood concentration in your bloodstream in just 15 to 20 minutes, instead of the 30 to 60 minutes it would take if you had food in your stomach. This creates what I call a caffeine shock. Your cardiovascular system is instantly bombarded with a stimulant at precisely the moment when it's most vulnerable. Blood pressure can spike by 20 to 40 points within minutes. Heart rate accelerates to potentially dangerous levels, and your body enters a state of cardiovascular hyperexcitability, where any additional stress, any sudden movement, any emotional trigger can push you over the edge into arrhythmia or cardiac event. I've reviewed case studies of patients who had heart attacks within 30 minutes of drinking strong coffee on an empty stomach. Their autopsies showed coronary disease that had been building for years. The coffee didn't cause the disease, but it was the trigger that caused an unstable plaque to rupture and form the clot that killed them. My father didn't drink coffee, so this wasn't his trigger, but I've seen this pattern in dozens of the patients I interviewed after their morning cardiac events. The solution: if you cannot imagine a morning without coffee, and I understand that completely, never drink it on an empty stomach. Always eat something first, even if it's just a banana, a handful of nuts, or a piece of toast, something to slow the absorption, reduce the concentration. If you normally drink espresso, switch to regular coffee. If you drink 3 cups, reduce to 1. And most importantly, drink at least 300 to 500 milliliters of water before you even think about coffee. Hydrate first, always. I want you to write down, honestly, how much coffee do you drink in the morning? And do you eat anything before your first cup? No shame, no judgment, just awareness. Because awareness is the first step to change. The fourth mistake is something many people do, thinking it's incredibly healthy. Intense exercise in the first few hours after waking up, running, weightlifting, high-intensity interval training, spinning classes, any activity that drastically raises your heart rate when your body hasn't fully adapted to being awake. Let me be clear. Exercise is fundamental for cardiovascular health. It's one of the most important things you can do to prevent heart disease, but timing is absolutely critical, especially for people over 60. Remember, in the early morning hours, your cardiovascular system is already facing multiple simultaneous stresses: elevated cortisol, spiking adrenaline, thick blood from dehydration, naturally higher blood pressure, and stiff blood vessels that haven't warmed up yet. Adding intense exercise at this moment is like asking an engine that's already redlining to shift into an even higher gear. Your heart, which is already working in overdrive just to maintain basic function during the morning transition, suddenly needs to pump vastly more blood to active muscles. Oxygen demand skyrockets to levels that may be impossible to supply adequately, especially if there's any underlying coronary disease. For young hearts with wide open and coronary arteries and elastic blood vessels, this might be manageable. The cardiovascular system has enough reserve capacity to handle the additional demand. But for an aging cardiovascular system, especially one with silent coronary disease that hasn't been diagnosed yet, this combination can trigger myocardial ischemia, dangerous arrhythmias, or even sudden cardiac arrest. The situation becomes even more dangerous when people exercise while fasting and dehydrated. Many people wake up, throw on workout clothes, and head straight to the gym or out for a run without eating or drinking anything. Intense exercise while fasting forces the body to break down muscle tissue for energy. It releases additional stress hormones, particularly cortisol, adding even more fuel to the fire. It can cause dangerous drops in blood sugar that further burden the heart and brain, combined with thick dehydrated blood that can't transport oxygen adequately. You're creating perfect conditions for cardiovascular collapse. Many cases of sudden death in gyms or during morning runs happen for exactly this reason. Apparently healthy people,